there hasn't been a lot of good news in this pandemic, but we've obviously witnessed a huge medical achievement with the development of the vaccines in record time, and particularly the mRNA vaccines. But for people who are immunocompromised, they sometimes don't mount antibodies in response to the vaccines, or they don't mount a full immune response. So what can you tell us about how the vaccines work in people who are undergoing cancer treatment, or even survivors who may be immunocompromised and get vaccinated?
Well, first, can I back up for a second before I answer that direct question, which I think is a vitally important question?
Please.
We have to remember that COVID has disproportionately impacted cancer patients. For the general public, if you get COVID, your chance of hospitalization is something like 25%. But cancer patients, it was much higher, and the chance of mortality with COVID, the combination of COVID and cancer, was pretty deadly. About 2 or 3 times the mortality rate of the general public. So we know already cancer patients were at a disadvantage because of their compromised immune status, and COVID was much worse for them. So any benefit from the vaccines would be really, really important. Now, we have known for a long time that cancer patients do not necessarily mount the same kind of response to vaccines, and it's not just limited to mRNA vaccines or COVID vaccines. It's true for all the vaccines that we might want to give them. And the problem is that we disrupt the immune system both with our treatments, and the cancer disrupts the immune system to evade the immune system and grow in the body. And that combination seems to undermine a response to the vaccines. Now, the big issue being discussed and debated, and we need more data on it, is how well does a third booster, for example, help immunocompromised people? So on the typical mRNA vaccine, giving a initial shot, then one booster, and maybe a third booster a couple of months after will increase the level of antibodies and T cells necessary to more effectively fight the vaccine. Frankly, that appears to be true, but how much better, how long the durability is, we don't know. We do have some growing evidence that the level of neutralizing antibody is a very important indicator of avoiding reinfections if you have the vaccine. So I think we have a way of monitoring whether cancer patients are protected and whether they need to take additional precautions, mask wearing, avoiding crowds, avoiding the public, if their body hasn't responded with suitable antibodies.
Well, that was actually going to be my next question, is whether you would recommend booster shots for this population. Maybe we don't know enough yet. I've covered the issue a little bit and know there are still lots of questions about it. And
well, you're the expert. You're the expert, yeah. If you cover it,
no,
more than
you
anyone. But I do think that, I have to say I'm a little disappointed in what we've been doing in the United States in terms of research and producing research. We have 163 million Americans vaccinated with these coronavirus vaccines, and we know we should be sitting on mountains of data about how they react, good follow-up in cancer patients, other immunocompromised patients, organ transplant patients, or rheumatoid arthritis patients taking some immune modulating medications. We just don't have enough data. And I think we would all like data, like, are there particular genotypes that respond better or compromise? And so giving them a booster isn't necessarily going to help them that much. Is there something besides the mRNAs that we can give to boost the immune response of these immunocompromised patients? I think those are questions we'd love to have the answers to. And I think, we're far from a definitive answer and guidance there. And so we're doing, making suggestions without real reliable data. And that, I think, is an uncomfortable position for any doctor to be in.